Okay, please, can you request to join the live? Okay.
Hello.
Hello, how are you doing?
Good evening. I'm fine. Can you hear me very well?
I hear you clearly.
Okay. Your network is a little shaky, but I can hear you.
Okay, that's fine.
Okay.
Okay, is it better now?
It's still breaking. Like I can't hear you very well.
Yeah. That's the problem. Let me see. Well, what do you think? Is it better now?
Your voice comes. Your voice is faster than your actions.
I think it could be reception then. I don't know what else to do about it.
Oh well. Can you go off and come in again?
Let's go and come back.
Yes, please. Because it's not really clear at all. Welcome. About to get started. We're just doing a test run. Waiting for our speakers. Okay. I see you. I do med health. Please, can you request to join the live? Can you send a request to join the live so I can accept? Okay. Hi, good evening. Kindly request to join the live. I do med health, please. Okay.
Hello.
Yeah, I can hear you better now.
Hope so.
Okay. Okay, so we're waiting for our second speaker to request to join the live. I can't seem to find the request. Okay, just a minute. Oh, okay. I've seen it. Okay.
Good evening.
Hi, good evening.
Good evening.
Hello, good evening.
Good evening.
Good evening, how are you?
You're
I'm doing fine.
welcome. Good to see you.
Because I need an earpiece.
Yes, you need an earpiece. Can you hear me very well?
I can hear you, but then I want to get an earpiece because your voice is kind of
Okay.
low.
Okay. So, Dr. Charity, I'm going to be going with Charity because I really cannot pronounce the other name. If you're okay with that. Her network. Wow. How are we going to manage network this time? Okay, I'm going to be going with Ebuka. Are you okay with that?
Okay. Yes, I'm fine. I'm fine with it.
I think the other name seems to be difficult for me, and I don't.
It's just
Okay,
Ebenezer.
Ebuka.
But then Ebuka is fine.
Ebenezer.
Yeah, but then Ebuka is fine too.
Okay, I go with Ebuka. Whoa. Okay, we have a few minutes left till 7:30, but we just want to ensure that we can hear each other very well and that the network is very clear. But for Dr. Charity, I don't think I can. Her network is unsteady.
Hello, can you hear
Kind
me?
of unsteady. I hope
She just
we
spoke.
can now. We can now. Yeah. Okay, I heard
Hello.
her now. I heard her. Okay, so let's see if we can manage with the network. It seems to be going off and on, but can you hear me very well, or you think my voice can be louder?
I
I
can
think
hear
it's
you.
fine.
Okay, okay. Oh, okay. So we have about 7 minutes more to
Okay.
start. Mm. Hope you guys are ready for us. Oh, yeah, 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 yeah. Because you guys are going to be doing all the talking and I'm going to be listening. So it's usually easier to listen, yeah. Yes, yes, yes.
So maybe I'm just going to need a few minutes to just get ready. Hope that's fine.
You want to get ready, like get dressed.
Like, not get dressed. I want to do something and come back. I hope
Okay, what we have is 6 minutes.
6 minutes.
I
Yes,
want
I
you to
actually.
introduce yourself as we start. So you can before 6 minutes.
Or can I leave it online and do what I'm
No problem. It's fine. It's fine. But just
okay.
it's fine. But I'll just need you to come back ASAP.
No problem.
Okay. Thank you.
You're welcome.
Hello. Welcome
Yeah.
everyone.
Fine.
We're about to get started. We have 5 minutes.
It's still online, so I just
Just be patient.
what do you want?
We're just having a test run.
No. It's fine. When you say that, they can put that.
Whoa.
What they suggested.
Hope you can hear me very well. For those that are just joining, you can indicate if you can hear me very well, loud and clear.
This is what to do best. So I don't know why.
Okay.
No, I give the listening parts. Yeah, I'm coming.
I think there's also room for us to mute our mic if we're not, if you're not talking. You can mute your mic.
Okay.
Yeah. But just remember to unmute when
On
you
mute.
yes. Okay, 4 minutes more.
Okay, while we're waiting for the 4 minutes, I also want to
Yeah,
find out, is my network better now?
very much better. Did you change your network?
I tried several. I actually tried juggling between
This one is
several. It's
way
still the
much
same one I was
better.
using before. Okay,
Oh, it looks different. It's way better. Way better.
that's good to know. That's good to know.
Okay, okay. Okay, 3 minutes. So I was saying I'll call you Dr. Charity. Are you okay with that?
Have you checked your Instagram?
Call me.
Dr.
Okay, you want to refer to
Charity.
me as Dr. Charity? I'm good. Dr. Charity, Dr.
Okay.
Akano, that's fine. Whichever.
Okay, is it Akano? I was saying Akano, but they said I wasn't pronouncing it right, so I decided to go with Charity.
Well, for me, so far you can spell it right, it's fine. Some call me Akano, some say Akano. Some, yes, the
Okay.
Yoruba side calls it Akano. Then the Igbos,
Okay.
they say Akano. Then some others, the
Oh,
Rivers will say Akano. So
okay.
just feel free.
So which is
So far you
yours?
can spell it right.
So which is yours?
Akano.
Akano. Wow.
It depends
Okay.
on just Akano is okay. But rather
Hmm?
than getting confused, Dr. Charity will go through all well.
Dr. Charity is perfect. I'll
Okay.
make do with that.
All right.
All right. All right. All right. All right. All right. Yay. So we have 2 minutes. 2 minutes left.
All right. No
Okay.
problem. Waiting.
Yeah. 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 Okay. Okay.
Okay. Ah,
Thank you. Thank you. Yeah, I can hear us loud and clear. Dr. Charity, can you see the comments as well?
Yes. Miss Sugumba, she says she can hear us loud and clear.
Okay. Okay. I just wanted to confirm. Okay. That's fine. Whoa. You're welcome. Can you still hear us?
yes, I can hear you.
Okay. Okay. I can hear feedback. Is that from your end?
Yes, but then he's not in. He's outside now.
Okay. Okay. So it's 7:30. We have 6 viewers. Okay, that's 7. So we'll just start because we have to stick to time. We should be done in about 30 minutes time. So I think we should start now.
Okay.
Okay. So good evening, everyone. You're all welcome to our Instagram live. This is going to be a really nice section. My name is Pharmacist Zipporah. I'm with Health Edge Pharmacy, Port Harcourt, and today we're going to be having a talk on breast care. We're going to be talking about breast diseases, breast care, how you can manage a lot of conditions, a lot of things about the breastfeeding. And we're also going to be taking questions from the, comment section. So feel free to ask your questions and make all your contributions. And today we have 2 able hands that are going to be our speakers for today. So feel free to direct your questions to them. So I'm going to give them a few minutes to introduce themselves. So we'll start with Dr. Charity. Just a brief introduction.
Okay, my name is Dr. Charity Akano. I'm a medical doctor with Hopeville Max Clinic in Port Harcourt. It's a general practice clinic, but we also run a specialist care. I think that's it.
Thank you very much. Okay, our second speaker.
All right, my name is Osuji Ebenezer Chukwuebuka. I am an exercise physiologist, and I am with ID MedHealth Global here in Owerri. Thank you.
Thank you very much. Okay.
You're welcome.
Thank you very much. You're both welcome. Okay, so I know everybody's excited about this, and we're going to really have a nice time here. So, like I said, feel free to, ask questions. And if you can't hear us, please do well to indicate so that we can make adjustments from our end. Okay. Okay. So, we're going to start with Dr. Charity. So, can you please tell us about a bit about breast care? When it comes to teenagers, pregnant women, breastfeeding mothers, and even those in, menopause. So what can you say about that?
Okay. That's more like taking everything in one bit.
Okay. Okay, you can start from somewhere.
All right, it's okay. Now, the breast, or let me assume some persons do not know what the breast is, although the breast is a structure, or is the structure that overlies the chest wall. It's more specialized or better developed in females because of its function in breastfeeding, feeding the young ones. And so it requires a lot of care. Let's say starting from the teen, let's say puberty, the care of the breast in puberty. The breast is about the first sign of puberty, in that as puberty commences, you find out that the nipple somehow sticks out, the breast gets rounder. And some of the other features you'll find out is that the breast becomes quite sensitive. At this point, the breast may not necessarily require any care, but you may need to educate the young woman on the changes her body is going through. At a particular stage, you may have to provide the girl or the young girl with a bra to help, help the breast stay firm, and to encourage her to ensure personal hygiene. I think breast care really starts at, let's say, when puberty has fully been attained. And that's where you will encourage a young woman, most times in their 20s, let's say late teens and 20s. Breast care usually at this stage will include personal hygiene, and will also include encouraging them to wear a firm, well-fitted bra. Also at this stage, that's where you also teach them about self-breast examination. Self-breast examination cuts across all age groups, but it becomes most important in the late teens and the early 20s, of course, till of the woman's life. And at this stage, talking about, I don't know if we start talking about self-breast examination at this point, or it's something we may have to encounter later.
Okay, we can still talk about that later.
Okay, so now let's get to pregnancy. Now, for pregnancy, during pregnancy, the body, of course, undergoes a lot of changes, and the breast especially also undergoes a lot of changes. You find out that the breast usually will get bigger, tender, and as such, you will encourage the lady to wear firmer bra, just as has been said during the other stages. But at this stage, the woman is preparing for breastfeeding. So there is need for her not just to ensure personal hygiene, but to also ensure that the nipple is ready for breastfeeding. Usually when you get to either your GP or gynae, whoever is preparing the woman for childbirth, the breast is usually examined for people that have, or women that has flat nipple, inverted nipple. That's at the stage where they are taught what to do to ensure that the nipple is ready for breastfeeding. Yes, personal hygiene, giving firm support, and preparing the nipple for breastfeeding. Those are the three. Then, during breastfeeding, the breast needs a lot of care at this stage because it's important for it to be, for everything to be in place so the baby can breastfeed very well. I'll still go back to personal hygiene. In personal hygiene, you should ensure that before the breast is touched, the hands are washed properly. Wash your hands properly before touching the breast, and it's important to take a regular bath. A regular bath is also very, very important. Then, while breastfeeding, you find out that you will need, not may need, you will need breast pads, breastfeeding pads. These pads serve to soak up leaking breast milk. Now, it's important to note that these breast pads should be changed often. If they're left in place for too long, it gives room for germs to grow, and of course, this will predispose the woman to breast infections and may also predispose the newborn to infections as well. So it's important for the woman to ensure personal hygiene, yes, changing the breast pad often, and also wearing a proper breastfeeding bra. There are some conditions that may occur during breastfeeding, breast engorgement, and all that. Feeding your baby more often usually will help in relieving such problems. I think that's basically what is done. I don't know if there's anyone I missed.
Okay, thank you very much. Yeah, for women in the menopause, what can you say about that? Any information about care on that?
Okay, let me start by saying that most times when women get to 40, there are some changes that usually will take place. From what the books say, that at 40 years, there's like a spike in estrogen. And so you find out that there is like an all-round weight gain. And this weight gain may also cause the breast to also enlarge. So there's that tendency for the breast to get a little bigger than what it used to be before. So the first thing is that the woman should not be surprised if she has to get a higher size of bra. Then the breast, from what we're told, gets a little more sensitive at this stage, gets a little more sore, and I think it's still being attributed to the spike in estrogen at this stage. It is said that this is all to prepare for the premenopausal or perimenopausal period. Then you find out that at this stage, the woman also is losing a lot of collagen. And collagen is also found in the ligament of Cooper in the breast. So there's that tendency for the breast to begin to sag. It might be slight at the beginning, but it continues. It is said that a firm bra usually will help support. It might not reduce the process, but it will give a lot of support, and that concern may not be there. Then the breast gets a little more lumpy at this stage. The breast gets lumpy, and that will require the woman to ensure she does her self-breast examination often. But that may not really be sufficient. She may need to see her GP more often, and for every doctor's visit, it's important for her to get a breast examination at least once a month. That's actually required. Then it is also encouraged that women should have their baseline mammogram at about 40, because the breast the density of the breast seems to change. The breast is denser in younger women, but at 40, if you have like a baseline, if there's need for you to do a mammogram subsequently, at least there's like you will know what to compare with the baseline. So being that the breast is more, the density changes, there's need to have a mammogram. And so that's one of the key, that's one of the things a woman needs to do as she's approaching menopause. Remember, at 40, most persons wouldn't have gotten to menopause. But before menopause, make sure you have a baseline so that by the time you get to menopause, if you have any changes and you have to do your mammogram, of course, mammogram should be done once or twice a year, depending on the risk, the surrounding risk factors. Some persons have a family history of breast cancer, and so there's that tendency for them to do breast mammogram, so that for them to do rather mammogram every year. But for others, they might have to do it for just maybe let's say once in 2 years. So in summary, I think the care of the breast before menopause and menopause, just perimenopausal and menopause, include one, personal hygiene, of course, wearing a firm bra because the breast may be sagging at that point. Then if you want to maintain your breast size, of course, you maintain your weight or you lose weight if you're gaining weight. A regular self-breast examination.
Okay, we lost you at a point, so we can hear you now.
Okay, in case there's a lump, your doctor should assess it, then a mammogram. And in some cases, a woman or a lady getting to her menopause may be required to do a breast ultrasound scan.
Okay. Wow, so much information, so much information. In fact, I never knew all of this, and I'm sure our audience are wowed by everything you said so far. Thank you so, so much. I forgot to add, if you have questions, please drop your questions on the comment section. We're going to ask them as the talk goes on. So please feel free to ask any question that you want and direct it to a particular speaker. Thank you. Okay, so we go on to Zipporah. Can you tell us about breast care involving women in sports?
All right, thank you very much. The issue of talking about breasts in women in sports, I'm aware that previously, I think that issue has been the reason why women do not usually engage in sports. But then things are changing these days. And I'm going to take this in 3 ways. I'm going to talk about it in 3 ways. First of all, I'm going to talk about the problem. I'm going to talk about the care. Then I'm going to talk about 1 or 2 myths about breasts in sports, generally for women. So first of all, there is a problem in sports, and one of the things that makes sports persons effective is comfortability, their ability to be comfortable in their own body. And I think that's the place women actually have 1 or 2 issues, because there is what we call vertical displacements, most especially when women are engaging in more intense sports. What I mean by vertical displacement is, of course, the bounce factor. That is, it's number 1, it causes discomfort. And number 2, of course, you are worried about perverts trying to, so, you know, these things try to get women away from sports. But then, thank God, in 1978 or thereabouts, the first sports bra was designed, and this has gone a very long way in helping women in sports. It was designed, it's called, I think it's a jog bra. And one of the ways this has been able to help is because, number one, women wearing this fit bra helps them to stop or at least manage to an extent the bounce factor, that is the vertical displacement of the breast while doing sports. And this helps to keep the breast at a place. And also it has some support features that, for example, there are people with very huge breasts, and at the time when there is no support feature from the sports bra, it tends to make the trap dig deep into their body, and this can cause a lot of pain. That you're avoiding, someone is avoiding bounce factor, is now feeling pain in the body, and when you start feeling pains in the body, it becomes a difficult one also. So I think one of the ways that we've been able to help reduce this issue in women is getting them to know that, all right, you can do sports and you can do it very well with this sports bra. Although there is a study, I think that was in 2013, from some Italian scholars, they said even at that, doing sports without sports bra is good, is advised. But then, of course, when we look at these other factors, like I earlier mentioned, the bounce factor, issue of pervert, you just understand, okay, we need to stick to the sports bra. And there are two types of sports bra. The first one is the compression bra, and this compression bra compresses or presses the breast as against the chest and holds it firm, such that it's almost very difficult for it to bounce around when the person is engaging in sports. And also there is this cup sports bra also that have a kind of a cup that holds firmly and supports each of the breasts so that there won't be any vertical displacement. And of course, playing some games like the soccer, the basketball, the lawn tennis, you find out that this is where this is most times felt. Again, athletics, yes, it's also most felt in athletics. Having to do this, okay. So having to do this, we found out that the sports bra is the best thing that's ever happened. And this sports bra should be well ventilated. It should absorb a good lot of sweat, because, of course, when it logs up sweat in the breast, it leads to breast soreness and some very dirty rashes around the breast. So it should be ventilated, absorb sweat. It should have a separate cup, and it should be well fit. Now, you know, sometimes in the era of I want to get something online, I want to buy something online, and most times people do not take notice to getting the one that is specially fit for them. And I think it's more like an advice also that instead of getting online, not like I'm trying to discourage people from getting things online, but then I think it's most advisable to approach a physical store where one can be so sure that you're not getting something that would be too tight or too bogus. And that being said, I think I'm going to talk about one or two myths about women in sports and breast issues. And the first one I'm going to talk about is there is no study to prove anywhere that engaging in exercise increases breast size. I don't think such thing is tenable. I think it's not found anywhere around any studies so far that I've been able to look at, except if it's the one I've not seen. And I don't think, okay, let me not say I've been exhaustive in this. And also,
Okay.
like Dr. Akano said earlier, I think when we start talking about sagging breast, there are some people that attach, I think for a long time, people stopped engaging in sports basically because even with their husband, they feel if we engage in sports, our breasts will sag. But then that's a big lie, because the Cooper ligaments, which is the one that is holding the breast to the chest, is not affected in any way during exercise. It's not affected in any way during exercise. In fact, if there is anything good, I think exercise is good. Is a good therapy for breast, and it shouldn't be something that should scare people away from coming to do exercise. And also, there are some talks somewhere that people breastfeeding, that okay, for future mothers, let me put it this way, for future mothers, they should avoid exercise. And I also think that is wrong, because I think breastfeeding is largely dependent on hormone secretion, and it has no business with exercise. So I think that again is not true. So I am saying that the breast does not increase or reduce in size basically because one is engaging in exercise. The breast doesn't sag because one is engaging in exercise. It doesn't affect your breastfeeding. It doesn't damage your breast for any reason. So if for anything one feels he wants to be secured in her own body, I think the best fit for it is exercise. So again, I think for those ones, it's not every exercise that would actually get you to start getting worried about the bounce factor I've said something about initially. Some exercises don't need you to think so much about this. For example, people cycling, you don't need to even think of, but then you can still wear a sports bra, but then it doesn't affect you. So I think basically, for women in exercise, the basic thing that they need to pay so much attention to concerning their breast is having a very good fit sports bra. I think that's the basic thing, and with that, you will be so comfortable in your body and you enjoy exercise. And once you enjoy exercise, it's going to be much more effective.
Oh, thank you so much. Wow, whole lot
You're
of
welcome, bro.
information. Yeah, we have some questions, but we're going to take your questions much later. So I'm jotting them down. And somebody said the volume is off. I don't think so. Might be network issues. Can you hear me very well?
Yeah, I can hear you.
Okay, so maybe it's the person's network. Okay, so I have your questions all jotted down. We're going to address them towards the end of this. Okay, so this is to Dr. Charity. Yeah, what are some signs of diseases in the breast?
What are some what?
Signs of diseases, like how can somebody know that the person has an infection or disease in the breast?
Okay. Okay, some features, some symptoms of
Okay, yeah.
breast diseases. This includes breast pain. Breast pain. Breast pain could be some causes of breast pain include hormonal changes. There are sometimes that it's related to the person's menstrual cycle. And so after the menses or the period, as it could be referred to, the pain usually will resolve. And there are sometimes that it could also be due to other forms of pain, like let's take for instance mastitis. Mastitis is inflammation of the breast. Mastitis could also be caused by an infection Most commonly, it is seen in breastfeeding mothers. This is usually caused when there's engorgement. Probably the mother isn't breastfeeding the baby enough, and you find out that the breast becomes engorged, very painful, very warm, and if it shows signs of infection, um, then it will require not just breastfeeding the child more often, it may require medication and, of course, seeing your doctor. Then other causes of breast pain could also be referred pain. Referred pain, we have an exercise therapist, and we have that there are times some persons after exercising, they could have pain from their back to chest wall that could be referred to the breast. But other than that, we also see breast pain occurring in more severe cases, just let's take, for instance, breast cancer. So whatever the case is, if someone has breast pain and it does not resolve with rest, it does not resolve with, let's say, mild pain medication, it's very important for the person to see his or her doctor. Then other features include breast lump. Breast lump, and that was why I made emphasis on self-breast examination. Some breast lumps could actually be harmless. Some breast lump could occur due to the menstrual cycle. You find out that some persons, just before their menses, they could have some lumps in their breast. When they examine their breast, they'll have them. Usually after the menses, it disappears. But if after the menses, this breast lump does not disappear, it's very important for the person to see to see her doctor. Please don't be mistaken. Men also have breast issues. Yes. Very important. Very, very important. Very, very important. I usually will tell my audience that while we're talking about breast care in women, because the breast is more developed in females, it's also important to educate the male. For any man that notices breast nipple discharge or breast lump should be evaluated immediately. So let's go back to the breast lump. If the breast lump does not resolve after the menstrual period, it's important for the person to see her doctor, where some examinations will be done and investigations, including mammogram, ultrasound scan, and biopsies will be done. It is now at this point that we will find out if it's an ordinary or what we could refer to as a benign lump or something to be worried about, as in the case of a malignant lump. Other symptoms or signs of breast problem include nipple discharge. Nipple discharge is usually normal, of course, when a woman is breastfeeding. But other than that, if a woman before, yes, nipple discharge could also occur, yes, nipple discharge during the tail end of pregnancy. During the third trimester, most women could actually have nipple discharge. But other than that, and during breastfeeding, nipple discharge is otherwise not normal. So you could have nipple discharge being clear, it could be yellowish, it could be bloody, it could be brownish, but just as I said, if it is not in a breastfeeding mother, which is milky, or just towards the tail end of pregnancy, it should be evaluated, as this could be caused due to hormonal changes, it could be caused due to infections, it could be caused due to other severe conditions as is seen in cancer. It could also be caused by what we call ductal ectasia. So whatever the case, the patient or the person requires evaluation. There are some other symptoms. I've mentioned lump, discharge. I think that's about it.
Oh, thank you
There may
so
be
much.
others, but sorry, it's very important for me to note here Looking at the breast, other things that could, apart from breast lump, you could also find out, I'm very sorry that I missed this, you could find some changes looking at the breast. You could find out that the nipple becomes inverted. You know, I talked about self-breast examination. Every woman should know what her breast looks like. So if you know what your breast looks like, and you notice that at some point, one breast is getting way bigger than the other one, then you may need some assessment. Although, normally, some women, one breast is usually bigger than the other one. But just as I said initially, you should know what your breast looks like under normal circumstances. Changes in the size of the breast, color changes. You could notice that there are some changes, color changes, maybe some red patches if the person is fair. Of course, not from trauma. If there is trauma, that's a different case altogether. But without trauma, you notice that there are some discoloration on the breast. You have what we call pudorant. Pudorant is what you see, like the orange peel, like the dimpled skin. Without trauma, a woman notices that on her breast. That's actually something to be concerned about. Such discolorations, you find out that the breast is retracting. It's like one breast is the nipple is retracting in, like something is pulling it from inside. Those are things to be worried about. And of course, I've mentioned the discharge, pain, lump. That's about it.
Wow. Yeah. So we really heard a lot, you know. So basically, because of our time, let's move forward to the other questions. Really appreciate that. When it comes to Nigeria, there are a lot of women that use this breast enlargement creams and things like that. What do you think about those? Are they safe, or should they be used? Does it even work?
Well, from what I know about the breast enlargement creams, I did like a survey, and what I was told, I was told it doesn't really work, so to say, and most importantly, it's not safe. It is said that most of these breast enlargement cream contain a lot of estrogen, and usually what happens is that apart from it not working, it is also infusing a lot of estrogen into the woman's system, and that's actually not safe for her. So generally, the brief survey I did, most persons say it doesn't really work. And as a doctor, I think considering the content of most of this cream, it's not safe.
Thank you very much. Okay, so this question goes to Osuji Ebenezer. As a researcher, why do you think women seek breast enlargement? And if they must do so, are there safer ways they can do this?
Okay, thank you very much. I'm going to take that question from with three answers. The first one I'm going to give is, I think I did a kind of a private study, and I found out that this is just a private study, so I'm not. So I found out that at least from my respondents, we have like 63% of these ladies who feel the reason why they actually go for breast enlargement is because they don't think that their breast is large enough. And they feel that out there, what the guys want, for if you don't have the huge breast and nobody's going to talk to you, no guy is going to stop you. And that makes them want to really go out there and do something for themselves, at least so that they can at least have a man to themselves and all. And again, I found out that at least that's 30% of them actually do it out of peer pressure, you know. Come on, all my guys have, all my friends, maybe this person have bought enlargement, this one have this one. I think I should have something too. Not necessarily because they think they need it, but then because that's the thing in vogue. And we find out that good number of them go to enlarge their breasts just because they feel that is what almost every other person is doing. And others just feel, I have money. I think that's less than 10% of them feel, I have money. So what am I supposed to use my money to do if not to at least, whenever I go out there, it shows on me that I have the money. So let me just go and be working on myself and improving myself as they may look at it. But then I, for one, wouldn't want to encourage someone to go for anything breast enlargement. I also advocate for people to be comfortable in their nature, because if it's not your nature to, it's not in your genes to have this stuff, you shouldn't really try to go out of your way to make it, because sometimes these things have adverse effects that are very strong and sometimes life-threatening. So I wouldn't want someone to really go into it. But then if someone, as the normal current global digital saying would always go, feel comfortable in your body. So if you will want to feel comfortable in your body, I think the best place you need to go to is to meet your doctor, and your doctor will discuss that with you and make sure you are doing it for the right reasons. And I'm very sure your doctor will refer you to the right place to have this done. But for me, I don't think I will advise anyone to go through that steps.
All right. Thank you so much. Okay, Dr. Charity, how can Hopeville Max Clinic help those experiencing those breast problems or breast diseases that we talked about?
Well, those are open. We run a 24 hours clinic, and for anybody that has any issues, it's important in fact, they are welcomed. In fact, I also want to mention that on every first Thursday of the month, between 8 to about 9 to 2 p.m., usually offer free breast examination for women. At least that's for starters. Then for others that have complaints, concerns about their breasts, we usually will attend to them, discuss with them, find out their complaints, examine them. And for those that need investigations, just as I had mentioned before, it could be an ultrasound scan, a mammogram, whichever the case is. It all starts from, of course, listening to the complaint, the examination.
Okay. And how can they reach you?
Oh, our address, we are located at number 7 Tom Nkotaria Avenue, Rumoba Estate, here in Port Harcourt. I think we'll send our number, the clinic number.
Okay, you can you can say if there's any of your staff that is logged in, they can put down the number.
Okay.
There's a question. It's not time for question yet, but yeah, concerning what you just said, is there also free breast examination for men?
Well, it's not something to laugh about. I've had a male patient that had nipple discharge. He's right at something. That had nipple discharge. We have to follow him up, and it's quite unfortunate that it was breast cancer and needed to be attended to. And it's unfortunate that some men will feel shy about it to talk about such problem, and by the time they present to the hospital, it's already well advanced. So for any man that has such complaints, a lump on the breast, nipple discharge, very important. You need to see your doctor as soon as possible.
Thank you very much. And to Mr. Ebuka, how can you, as the ideal med health, how can you help people to maintain a healthy breast?
Okay, thank you. So at ID Med Health, our slogan is we're creating a healthy world. And one of the ways we do this is by putting out health informations out there on our blogs and on our vlogs. And I know people have been able to get solutions to what they've been looking for by reading some of the articles we've placed there. And we have several articles on women or female reproductive health that we have on our blogs. And I think people can actually go on our blogs and even our YouTube vlogs also, and get to read some of these things, get to watch some of these videos that we put out there that's been changing lives all this time. And also, we also have a whole lot of partnership going on with us at this point globally, where we have people, we have nurses, we have doctors, we have specialist doctors also who write down articles, who send information for us to put it on our blog and let people know what is happening around. Also, we also look for partnerships like this exact one we are doing right now that will promote female health and their reproductive system. We rush it because we know that there are so many women out there who needs the informations that they can't get. Because one thing is this: without information, you live a very careless life. And that is what we want to bridge. We want to bridge that gap by letting people know what has been happening. And of course, by doing that, we not just the women, everybody, we help to reduce death and so many unnecessary things that have been happening. So I think our blog is doing a whole lot out there. So yes, and I believe we're helping them through this way, and we keep helping till the end of time.
That's amazing. Thank you so
Yeah.
much. And of course, apart from healthy nutrition to maintain a healthy breast, there are also some supplements you can take that can also help the breast. Supplements like vitamin A, vitamin D, and so many others, which you can also get from the pharmacy. Health Edge Pharmacy is also key into supplements, so you can also get your drugs online. You can, search our Instagram page and chat us up on Instagram. We'll be happy to, provide you online or offline with the drugs that you need or necessary to. You don't really have to wait till you have breast issues to maintain a healthy breast. So you can also do preventive care, which is also key for you to have a healthy breast. So we have some questions. I'll just take about 2. So we've answered some along the way. Some persons were asking for supplements for saggy breasts, especially for young mothers. Would any of you want to talk about that?
Okay. Supplements for saggy breasts. About breast sagging. Hello?
Yeah, we are with you.
Okay, about the breast sagging. Usually, I remember I mentioned age is one reason why the breast will sag. Then another thing is changes in weight loss could also, of course. The most important thing to do to help your breast from sagging faster than it should is something that might sound not so important, but one, a good weight control. Secondly, to wear a good bra. And About supplements, I actually do not know any healthy supplements one could use. There are sometimes people will recommend all manner of things. Although some persons say that helping the muscles of the chest, the pectoris, usually will help reduce the sagging effect of the breast. So they usually will say maybe push up, while some other schools of thought say it does not really help. But some others will say keep your chest muscles firm and the sagging won't be as fast as it is. In general, I would say maintain a good weight, wear a good bra. Those are just two important things I can really mention.
Okay, thank you very much. Somebody also asked about are there some side effects of breast enlargement such that so that people will get discouraged from doing this breast enlargement? You know, I think that's directed to Ebenezer.
Oh wow! I know that breast enlargement, of course, talking from clinical view, some of the drugs they inject into the body is not really healthy enough. Again, I am not so sure about the procedures that is involved. But then I think I got a story of I think that's butt enlargement anyway. But then I also dread anything enlargement. The story of a lady who lost her life, and these are some of the stories we keep hearing here and there and here and there. So I think to be on. Yes, to be on the safe side, I think one should avoid it. One should avoid it.
Okay, thank you very much. Someone is also asking if there's if you need recommendation before going for supplements. Yes, you need recommendation. You can see your pharmacist to recommend these supplements for you. So of course, you need to get information on these drugs before you start using. So your pharmacist will be more than happy to provide you with this information. We at Health Edge Pharmacy, Port Harcourt, we give information on drug use before giving you the supplement. So any information you'd like to know about drugs, you can always consult us on our Instagram page or in our walk-in shop if you decide to. So this has really been an amazing section. In fact, me personally, I've learned a whole lot from this, a whole lot. And it's so much information. Wish we had more time, but this is going to be the end of the talk. We thank our speakers so much for making out their time. Time is indeed precious, and they've made out their time to, give us this health talk. If you have more questions, you would like to ask for either the pharmacist, for the doctor, or for ID Med Health, any of them, you can always contact them using their Instagram handle to get more information on this. And we're going to be having more programs, more talks, health talk. So we really appreciate if everyone can key into this health talk and benefit from it. Knowledge is power, I always say. So thank you very much.
Please.
Okay, you want to say something?
Okay, the number, I actually was trying to get the hospital number, 081, for those that can get it, 081 38 33 6726, or 081 80 73 7590. These are our hospital lines for those that have more questions and those that want consultation as well.
All right. Also, I think it will make sense if I drop our blog site, www.idmedhealth.com, so you can visit our blog and you get to see so many things that will help you out. Thank you.
Okay. Thank you all so much. Thank you all. Thank you all.
Thank you very much.
Night.
All right. Take care. Thank you. Bye, everybody.
Bye.